So, what's the difference with accelerated versus conservative rehabilitation programs after surgery? So, Longo et al. In 2021 set out to answer this question, right? So, he's looking at a lot of different studies. And the definition of conservative rehabilitation was basically having complete immobilization of the shoulder for 6 weeks, right? So, that's a very, very conservative approach. Basically, don't do anything with your shoulder, put it in a sling for the first 6 weeks, right? The second group was called the accelerated rehabilitation group, and they gradually reintroduced movements before the sixth week. So, group one, don't do anything for 6 weeks. Group two, do stuff before 6 weeks. Is there a difference in outcomes? So, I think it's important to actually talk about the type of tear that was in the study. Like we said previously, there's a difference between a small rotator cuff tear and a large one. So, in this study, they were looking mostly at full thickness rotator cuff tears. I went back and tried to look into some of the studies that were cited in this analysis, and I couldn't find the types of tears in every single study. There's a lot of them, but largely it looked like we were dealing with full thickness rotator cuff tears, right? And what's also a little confusing is that active mobilization was started at different time points in different studies, right? So in some studies, two of the studies included in this particular meta-analysis, two of these studies, folks were able to perform active range of motion immediately after they've had surgery, right? Two of the studies were able to start performing active range of motion at week 3. And two of the studies, folks were able to perform active range of motion at week 4. One of the studies, folks were doing active range week 5. 4 of the studies, active range at week 6. And 3 other studies were unspecified, okay? So again, this actually makes it pretty challenging to look at this meta-analysis and get a lot of meaningful information from it, just because they're taking protocols that are having people start exercises, different exercises at wildly different times, okay? In this same study, folks were starting strengthening exercises in different time periods as well. In 4 of the studies, folks were starting strengthening somewhere in the 4 to 6 week range. In 2 of the studies, they were starting strengthening in the 8 to 9 week range. In 3 of the studies, they started strengthening at week 12. In 2 of the studies, they started strengthening at week 16. In 3 of those studies, they started an unspecified time. All right. So we get a general idea of early versus delayed in this study. But the other piece is that you have to take these studies with a grain of salt, just because everyone's starting their active range, their passive range, and they're strengthening at different times. So it's really hard to tell what aspect is leading to a poor outcome or good outcome. So overall, what did they find? There was no statistical significant difference in the re-tear rate among the accelerated and conservative groups. There was improved external rotation at 3 and 6 months of follow-up in favor of the accelerated group. So a little bit better range of motion in the accelerated group. Once you adjust this data for the tear size, particularly in large tears, large lesions, there is increased number of re-tear events in the accelerated group. And tear size may influence the early postoperative rehabilitation outcomes for tears that are large, so 3 to 5 centimeters plus, right? The other piece is that this evidence was mixed. So large tears in accelerated groups in some of the studies had a greater re-tear rate, and then large tears in other studies with the accelerated group had the same outcome, right? So I think that's just important to keep in mind. However, this does kind of tip my hat to the thought that, all right, if you have a large tear, maybe we're not going to go as accelerated, because if we delay things, it's probably going to be a little bit safer. If you guys are liking what you're listening to right now and you want to continue with the rolling, I have another video for you. It's called When Do Rotator Cuff Repairs Fail? So unfortunately, a chunk of these rotator cuff repair surgeries will fail, right? And it's important as physical therapists to know when these are actually occurring so we can be a little bit more cautious during this time period. So I'll leave a link above my head and go ahead and learn a little bit more about when rotator cuff repairs fail after surgery.